Hi, I'm Hannah, Programmes Manager at the Macular Society, and for this session I'm joined by three of our wonderful Skills for Seeing volunteers, Pat, Julie and Janet, to share some of their top tips on practical ways to manage low vision. So thank you so much for being here, and I'd love to come to each of you in turn to introduce yourselves and tell us why you started volunteering for the Macular Society. So Pat, I'll come to you first.
I was diagnosed about 20 years ago. I went to the optician for an annual check and they said there was something wrong, sent me to see a consultant. I saw a consultant who said to me, "Oh, you've got AMD, you'll eventually go blind and there's nothing we can do for you." So I was devastated. I thought, how am I going to get to work? How am I going to do my work? How am I going to do anything? I went home and spoke with my wife. My wife went online to find out what AMD was. I'd never heard of it. And she saw the Macular Society. I contacted the Macular Society and they told me I should never have been told that and give me lots of good advice. So that's how I got diagnosed. And then when I retired about 15 years ago, I saw the Macular Society were looking for volunteers and doing some courses. So I volunteered some 15 years ago and went in 2 courses at the time. And I've got many volunteer hats at the minute.
Wonderful. Thank you so much, Pat. And Jan?
Yes, Janet Doyle. Morning, everyone. Slightly different story for me. I retired 13 years ago after being a high school teacher for the whole stretch and did a few volunteering things that didn't really interest me very much. And then I saw in my local library a poster for the local Macular Society group. And in those days, with a contact phone number. So I contacted and I went along and very quickly got involved with the group. The reason why that poster so jumped out with me was because my dad had had macular degeneration in the 1980s. My mum had died quite young. My sister and I lived at a distance and I saw my dad get pretty depressed and isolated. And when he was diagnosed at the hospital, bearing in mind that this is just about 40 years ago, he was told the only advice, eat your dinner off a white plate. That was it. Anyway, there was a vision aid centre near me, near Chester, and I took him along. And in those days, all that was available was a large button telephone, large button calculator, large playing cards, and also a talking phone. He said to me, could I get one of my students, because I was in a science department, to make him a fluid indicator? Because, of course, in those days, nothing available. And the best solution was a ping pong ball. And I know some of the members of the group that I'm chair of, that is what they use instead of an electronic liquid level indicator, because it doesn't make a horrible noise. It's very easy to see. You can get them in different colors. Anyway, I've stayed very involved with the Macular Society, went on to a course in Manchester, went to Skills for Seeing workshop, recognised everything that my dad couldn't do, and was accepted for the course. And so 10 years down the line, yes, still very involved with the society and love what I do.
Oh, wonderful. Thank you, Janet. And Julie?
Hello, Julie Parker. I was diagnosed 30 years ago. I'll be 70 next year, so quite young to be diagnosed. And like Pat, exactly the same. That's what I was told. I've been volunteering since I was a child, through Sunday school and right the way through my career, everything like that, done a lot of voluntary work. So I contacted Adele Francis, who's our local regional manager. And very quickly, Adele said there's no local group in Middle Morgan, where I live, despite the fact that the hospital is one of the biggest eye clinics in Wales, as far as I'm aware. So, yeah, I agreed to be a group leader. And then I went on to learn eccentric viewing and study eye strategy. And I now help as many people as I can. I also work on a contact line for another sight loss charity, but it puts me in touch with people with macular And I love it. I absolutely love it. And I've learned so much and met so many people. So, yeah.
Oh, that's fantastic. And it's so lovely for us that all of you have been such long-standing volunteers with a wealth of knowledge and experience that you can share with us as well. Understandably, being diagnosed with a macular condition can feel really, really overwhelming. So what initial advice would each of you have to give someone who has been recently diagnosed? So Julie, I'll come back to you first.
Always when I get a new person, whether it's on the contact line or face-to-face, is isolate yourself. It is scary. They're frightened of white sticks because they feel vulnerable. A lot of them are elderly, a lot live on their own. But I just encourage them to don't be vulnerable. Ask, use your mouth. You can't see maybe as well, but you can speak and ask for help. And the group members are great. Macular Society with contact lines, buddy, it's all there for us.
Fantastic. And Janet, how about you?
I think that one of the things that people, when they're diagnosed, being probably of an age group where they might not have done much biology at school, will be to learn about the structure of the eye and to realise how much more of the retina is available for them to use. And okay, they've lost that very useful little bit, but there is an awful lot of the eye that still is available for use. So I think that is something really worth doing. Get a biology book out of the library, ask your child, ask your grandchild, and they, because of the education they've had with combined science and everything, they will have that knowledge. The other thing I think is quite useful is to get some sim specs from the Macular Society, so that you can hand these to your friends and family and they can look through them. I know our sim specs are sort of the worst case scenario, but at least it can help those closest to you to have a bit of an understanding as to what you are experiencing.
Absolutely. Brilliant. Thank you so much. And Pat?
I would say to people who are diagnosed to begin with, don't sit on it. Seek help. Ring the Macular Society. They can help. Find out if there's a local group. Join the local group. Get some peer support from the local group. There are loads of help out there. Loads of things you can be taught to learn to gain some independence back. And it's not the end of the world. There are loads of help out there. So that would be my advice.
Wonderful. I think for a lot of people, it can be difficult to know where to begin, particularly when it comes with practical ways of managing low vision. And one thing that can be overlooked is lighting. So Julie, I don't know if you're happy just to talk through some of the ways that lighting can be really beneficial for people.
It's my number one suggestion for other eye conditions too, but especially macular. So in Wales, we have a lot of problems from the point of view of the ROVI, the rehabilitation officers, the ECLOs, the eye clinic liaison officers, and other people who should be there really to pick up the pieces when somebody's been diagnosed. The other problem we've got in Wales is that wet macula is usually you're sent to the hospital and given some treatment and some advice, but dry macula, you're sent away. But you have the same problems with reading whatever you've been doing. So I always say to them, you need to get proper advice about lighting, and we have various other places we can signpost them to. I try to encourage them not to spend too much money on it and to direct the light at whatever it is they're trying to look at. So there's a torch, I think it's a Wirch, but you can get them, you can get really bright torches at places, DIY places, and I think the supermarkets, one of which has got a magnet on it as well. So it's a very bright light. It's easy to hold, and it's got a magnet. So if you drop something on the floor that's metallic, you you should be able to find it, because lots of people I know are either out in the garage still playing with their cars or fixing things, or they're doing crafting. So one of their frustrations is that they can't see to pick stuff up. So certainly lighting, kitchen, absolutely essential. I say to them, get yourself a good white light. Bring it into the kitchen if you can't leave it in there. Make a habit of always taking it as your best friend and keeping it in the kitchen, and direct it onto whatever it is that you're trying to cut. Because a lot of people live alone. And we do try to force the Rovies and Eclos to get them marked up as urgent, but that's quite difficult when it's a dry macular condition. It's quite difficult to try to get somebody out to sort the lighting. But we have got care and repair here, and they will often give advice as well. I don't know what it's like in England. We have free low vision aids here, but everybody goes to get their low vision test. So, and outside, if I'm out in the sun and it's really bright, I get a blind spot. So again, where the cover all the way round glasses, they're provided on loan here to keep the sun out of the side of my eye, because otherwise I know I'm going to fall. And the same in dappled light. I carry a stick with me, walking stick or 2 walking sticks if I'm on uneven ground, because if I'm in dappled light, my eyes don't adjust. And the same in the house. I can be in dark like this as long as every room is dark. If I'm in a dark room like this and then into a light room, that's when I risk falling. So I am careful. Unfortunately, I do live with other people, so there's not consistent lighting. But yeah, I try to keep the lighting as consistent as possible. And just, yes, if I can't read something, it's to go to the window, because I can't use magnifiers, because my central vision is not very good. The magnifier just makes the bit I can't see bigger. So it's better for me to go to a window or stand under a fluorescent light or something. So yeah, that's about my lighting.
Brilliant. No, those are some really wonderful tips. And as I said, I think it is an area that a lot of people don't think to explore in those initial stages, and it really can make a huge difference. But as well as lighting, there is obviously a whole world of different low vision aids out there. So from magnifiers to things like bumper pads. And Pat, I know that you talk about a lot of these options and explore them. So what are some of your perhaps top tips for getting started with some of the more cost-effective low vision aids?
Bump-ons have many uses. You can get them in a pad. They're tactile. They're about the size of your fingernail when you peel one off, and you can stick it wherever you want. And the areas I suggest to people is front door. You can't find the keyhole. You know where it is, but you can't actually feel it. To put the key in, put a bump on there, you can feel it, you know where it is. As soon as you get inside the door, you know there's a light switch on your right or your left. You can't see it, you know it's there. Put a bump on the red in color, and you can probably see the red in color, but you can certainly feel it because it's tactile. Then when you get similarly in anywhere around the house, sockets, you can't see where the socket is, put a bump on where the socket is. In the kitchen, they have numerous uses in the kitchen or around the house. In the kitchen, your washing machine, most people only use one setting on the washing machine. If you put a bump on where that setting is, then you can turn the dial around to that setting. Similarly with a cooker, normally, depending on what you normally use, or your grill. Your microwave, bump on the normal setting you use it on. Dishwasher, heating, the heating control. If you put a bump on, then you can set it at that setting. You just turn the dial around to that setting. So the bump-ons have numerous uses around the house. As other things, little coloured girls' hairbands, they're very useful. You can put those, say, for instance, in the bathroom. You can't see which is the conditioner from the shampoo, and you put a different color on each one. It's just a simple tip that don't cost any, very, very little, and that will identify it. Similarly, toothpaste, just in case. I know of a situation where some guy went to clean his teeth, and his wife had had a cold sore the night before, and she was dabbing Savlon underneath her nose, and he went in to clean his teeth and used the Savlon. He said it doesn't taste well. So by putting little coloured bands around things like that is a great help. Similarly, you can put them on jars, tins, different colours. If coloured hairbands are not big enough, you can get many coloured tape, sticky tape. It's very useful. You can put it on things like that. But the best areas for things like sticky tape is trip hazards. If you put one on a trip hazard, a red one or whatever color you want, you get different colors, whatever suits you. It will show up, and you'll know there's a trip hazard there. If you go out in the garden or come back in, there's trip hazards all around the house. On the stairs, if you live in a house with stairs, if you stand at the top of the stairs and you look down, you can just see one big tunnel. You can't see the steps. You can put colored tape on each step. So those are, simple ideas to help. There are lots of them. I have got 2 big suitcases full of stuff I demonstrate, but these are just simple, cheap ideas. And the other thing is, if you're cooking in the oven, you can get a guard that goes over the front of the grill, and you can buy them red in color, and you put your hands in, it stops your hands from getting burned, your wrists or the back of your hands from getting burnt. You can touch it, up to 200 degrees it works. So it's a very useful tip. The other thing is, in the kitchen, if you're chopping onions and things, potatoes, fish, you wouldn't use a white chopping board for that. Use a different color, a red one, or something you can see what you're trying to do. Or similarly, red meat, use a white chopping board. There are several different colors of chopping boards out there. And knives, if you can't get colored handles for the knives, you can put the colored tape around them so you know what type of knife it is. So there are many, many tips like that cost very little. So those are just simple, cheap tips for around the house.
Perfect. And Janet, I know that you also have some quirky ideas or things that people may not have thought of.
Yes. Firstly, before we leave the lighting issue, can I just say that, of course, most people would now have a phone, and I will sit with the light on my phone if I'm having a cup of coffee and wanting to look at the newspaper or wanting to look at something. If the lighting in the cafe isn't very good and they haven't got any additional lighting, then turn the lighting on your phone. The other thing I would also say is we must make sure that people wear their glasses. As I explain to people, even though a lot of people will say these glasses don't do anything for me. Well, the optician has given you a pair of glasses of a prescription, which will produce an image on the retina, regardless of whether the retina really works properly or not. So if you're going to try and improve the vision that you've got, then please wear your glasses, because at least then, whatever else you can do, that image is falling onto the retina. And look after your glasses. I have seen so many dirty pairs of glasses. You're not going to damage your glasses by rinsing them under the tap in the morning with just a drop of washing up liquid. And, you might go and visit someone who is dependent on carers. And I do feel that that is something that we need to emphasize to the caring profession, that please make sure people's glasses are clean. Yeah. I think once you are first diagnosed, you've got to be a little bit selfish. You've got to make sure that your vision works for you. And I think one of the things that struck me when going into people's houses with Skills for Seeing is, you know, the arrangement of chairs. Everything looks very formal. And you say, well, can you see the television sitting there? And no, they shake their head. No, very not very. But, you know, my husband or my wife doesn't like me moving the chair forward. I can see Julie nodding her head here. And I think, you know, we have to say to people, look, this is your eye condition. You have got to make things work for you. And if that means that you're going to be lying in bed wearing a headband with a light on it and possibly an eye patch, but then you can read, then so be it, as one of my lovely ladies from my group does. And working out ways that are better for you, regardless of what other people say. You've got to be a little bit hard-skinned. If you enjoy your hobbies and you want to keep doing them, then it may well mean that you need extra aids that are going to make you look a bit silly. For me, using my sewing machine, threading it up, another pair of glasses go on top of these. And it just enables me, it just provides extra magnification. It enables me to thread the sewing machine without having to call for someone else. I think something else is partners can be over-caring when people are first diagnosed. They want to do everything to try and make tasks easier. And that doesn't always work for the person who has got the macular diagnosis. You know, they still want to be doing things for themselves. Most people are still keen to be very independent. And let's face it, no one knows what those next few weeks might be. And is your partner going to be in hospital or a worst case scenario? So I think we have to encourage people to keep their independence as much as possible. And this is where a membership of a group comes in. Our group, we get a lot of people. We normally have very serious speakers, but last month we had a large print games meeting. And, you know, it was amazing what we managed between us to bring in. I think I shall have to put that onto some Macular Society site as to the games. You know, you can get all sorts of things, large print. Just need to do a bit of research for them. And yesterday's meeting was on Charles Bonnet syndrome. The manager of Where We Meet has done a big overview of research. She was fantastic, and members contributed so much in the discussion that they hadn't really talked to people about before. So being a member of a group brings lots of benefits besides, you know, a pot of tea and a cup of tea and a biscuit. Right.
Fantastic.
I think so many other things here on my list. I don't want to take up the time, Hannah.
No, that's fine. I think I'll come to each of you then for a last piece of advice that you would give people to help in managing their low vision. So Janet, I will come back to you. So if there's a last piece of advice you'd want to give people, what would it be?
Yeah, it would be to keep being involved with society. You know, if you're going to an art gallery or a museum, contact them beforehand. Have they got a large print catalogue? And if not, why not? Also, make sure if you can't access a menu for a restaurant on your laptop, contact them beforehand. Please, will you print me off a large print menu? If you're a knitter, go to the library or somewhere, ask for them to enlarge your knitting pattern. So my advice would be, you know, think outside the box and try to keep involved with society as much as possible. Yeah.
Fantastic. Thank you so much, Janet. And Julie, Vital guidance for you.
Yes, mine definitely is using all your vision. So keep in touch with Macular and get to use that peripheral vision. I use the example of sports people. I'm a Formula One fanatic, and the drivers practice their peripheral vision, using their peripheral vision, and the young men with good vision. So I always use that as an example of it's not daft, it's not, it's not being, you've got to stop being vain. You've got to think about your sight and use that peripheral vision because it's so important to practice. Yeah.
Absolutely. Thank you so much, Julie. And Pat, finishing off with you.
If you got an eye clinic liaison officer in the hospital, get in touch with them to organise a low vision assessment for you, because you can spend money on things that are no use to you. The NHS in this area send you to an optician who can provide magnifiers, the right type of magnifier, up to £100 free. On the NHS. Also, there are loads of other sight loss charities out there who can give you advice. And in my area, we've got a Century Services, which is provided by the county council. They can come to your home, make an assessment of what might be useful to you, and provide you with more equipment free. So seek help from any of these places, but do get a low vision assessment. Don't spend a lot of money on something that you're never going to be able to use or that's not of any use to you. That would be my advice.
Absolutely. Well, thank you so much, Pat, Janet and Julie. This has been a really interesting discussion, which I'm sure we could continue for many more hours. But we really hope that those of you watching have found this session helpful and now have some fantastic ideas to explore and enjoy the rest of the annual conference this year.